Fibroids are the #1 cause of hysterectomy in the United States. They're benign tumors, so they don't turn into cancer. They're really prevalent. A lot of people have uterine fibroids. The symptoms are typically menorrhagia or heavy bleeding, or bulk symptoms, pressure, bloating, urinary frequency, back pain. The menorrhagia can be quite significant, resulting in fatigue, anemia. There's a lot of lifestyle limitations that occur when you have that degree of bleeding. Canceling trips, bleeding through your clothes, trying to figure out how you're going to make it through office meetings or how you're going to get on airplanes, how you're going to drive your kids to school without needing to stop by the bathroom. So many women who seek out uterine artery embolization wish to avoid hysterectomy. And for whatever reason, either they want to have children or they don't want to have children, but they don't want to have a hysterectomy. UAE is a fantastic option. UFE stands for uterine fibroid embolization. It's also occasionally called UAE or uterine artery embolization. So embolization is the process of stopping blood flow to a tumor. I block the blood supply by putting a tiny little catheter through the wrist and into the uterine artery. I then inject an embolic particle, which is like a little grain of sand. So with no blood supply, the tumors will not be alive. They will stop growing, they will shrink, they will devascularize, meaning have no more blood supply, and they will lose their bulky density and then slowly atrophy. And so one great thing about uterine artery embolization is those catheters will kill off all the fibroids that are in the uterus. Uterine fibroid embolization is a minimally invasive treatment. There is no scalpels, there's no cutting. We just go through a tiny little needle access in the wrist. I'm not stressed doing this procedure. I don't want the patient stressed. So whatever we need to do to get the patient to be relaxed, we'll do. But the procedure itself doesn't hurt by nature of the fact that it's minimally invasive. If women could hear one message, it would be if you are seeking treatment for uterine fibroids, make sure you are hearing about all your treatment options. If you want uterine artery embolization, you need to speak to an interventional radiologist. You need to come in and have a full consultation about your specific uterus, your specific fibroids, and what uterine artery embolization can do for you. I really think we've definitely made some headway in getting uterine artery embolization out there as a treatment option, and now we need to make sure that women are getting accurate and correct information.